Hello, this is Yaozhu Chen. I'm an outcome researcher from Takeda's Global Outcomes Research and Epidemiology Group. It is an honor to speak on behalf of the author team to introduce this study that measures the economic burden associated with diabetic gastroparesis in the United States using the real-world claims database. Gastroparesis is a gastric neuromuscular disorder, and diabetic gastroparesis is one of the main subtypes. This disorder is characterized by poor glucose control, suboptimal nutrition and hydration status, greater risk for complications, frequent need for hospitalization, and poor quality of life. So diabetes gastroparesis is not only the marker for poor current control status, but also a predictor for poor future outcomes. So this retrospective cohort study quantifies the outcomes impact associated with diabetic gastroparesis in terms of healthcare resource utilization and direct medical costs. The idea here is first to identify a cohort of patients with diabetes, a cohort of diabetic gastroparesis patients who will be matched by a cohort of patients with diabetes but without gastroparesis. So then the cost differences between the two matched cohorts will be regarded as a cost burden associated with having gastroparesis. Data source is Optum Claims Database, which is from one of the largest payers in the United States. And its beneficiaries capture all the age groups, including the elderly. The patients newly diagnosed with diabetic gastroparesis were identified via diagnosis and also the procedure codes, and also other selection criteria such as age and also continuous enrollment. For other group of patients with diagnosis but no gastroparesis, similar selection criteria were also applied, as this group does not have a gastroparesis diagnosis, so a pseudo date was randomly picked from the study period. Time window for assessment for this study is from 1 year before through 1 year after the diagnosis date. To ensure the only difference between the two matched cohorts is with versus without gastroparesis, a one-on-one propensity score matching with nearest neighbor approach was applied by controlling for patients' baseline demographic and clinical characteristics. After the matching, the standard differences between the two matched cohorts are as shown here, are within plus and minus 10%, which indicate that the balanced matching has been accomplished in this propensity matching exercise. And then look at the patient characteristics here, shown here. The matched patient cohorts, the average age is 62 years old within the both cohorts, and about 2/3 of the patients, they are female. And more than half of the patients, they are Medicare insured patients. Further, we can look at the comorbidity status of the patient cohorts. Per the comorbidity list as defined by Charlson Comorbidity Index, we can tell that close to half of the patients here, they are with chronic complications as shown here. So, moving to the outcomes of annual health resource utilization as presented in the table 2. In both the year before and after the year before and year after the diagnosis, gastroparesis cohorts had higher portion of the patients with healthcare resource consumption across medical service settings. And on average, in the interim, the gastroparesis cohort also had a higher per capita resource use in terms of the quantity. Translating these findings from health resource utilization into medical costs, we can move our screen to the monitor as shown here in Figure 3. Diabetic gastroparesis patients had a significantly higher annual costs across all resource use categories. And hospitalization was the biggest driver for the annual cost differences between the two matched cohorts. The average incremental annual cost for the cost were 28,318, which is considered as per capita per patient burden associated with having diabetic gastroparesis. As conclusion, diabetic gastroparesis has imposed significant burden to the healthcare system and all stakeholders in terms of the burden of the diabetes. And also this suggests that gastroparesis needs more attention from both clinicians and researchers in terms of prevention and management for better diabetes care. Thank you.